Hello friends, and welcome to an episode in my new series, Learning Pharmacology with Zeta, where we talk about trending topics in modern medicine. You may wonder why I'm in the gym today. Well, this is a place where I spend most of my free time, trying to keep fit and healthy. Seeing physical results in the gym, however, can take a long time, often years to achieve, especially for people struggling with obesity, who may experience detrimental comorbidities as a result of their weight. What if there was a drug that claimed to make you lose weight while being efficacious and safe? Sounds surreal, right? Well, today we will explore this possibility by diving into the Ozempic craze. It is no secret that humans in the 21st century mostly live a sedentary lifestyle. In fact, more than 25% of adults in England alone are estimated to be obese, with 37.9% being overweight, and these numbers are steadily increasing. In science, we're often told about the comorbidities that arise from obesity, such as it being the second most preventable cause of cancer, type 2 diabetes, cardiovascular disease, and arthritis. This can have a detrimental impact on these individuals' quality of life, with individuals also reporting feelings of isolation and depression. Improving these people's quality of life would also alleviate a huge burden in the NHS, as obesity-associated NHS costs can rise to £6.5 billion per year. This is where a recent drug called Ozempic offers significant promise. Ozempic is a type 2 diabetes medication prescribed to patients to manage the blood glucose levels. The active substance in Ozempic that produces its effects is called semaglutide. Much like how insulin is administered to diabetics, the drug is taken as a once-weekly injection and belongs to a group of medicines known as glucagon-like peptide 1 or GLP-1 analogues, and was developed by a Danish pharmaceutical company, Novo Nordisk. Being a GLP-1 analogue, Ozempic essentially mimics one of the hormones that we produce in our body, known as GLP-1, and selectively binds to and activates the specific receptor for that hormone in the body. This triggers a nerve signal from where the receptor interactions happen in the body, usually in the gut, to your brain's regulatory center, known as the hypothalamus. This results in neurochemical changes and the release of hormones to increase satiety, the sense of feeling full, and ultimately reducing your appetite, and therefore the food that you eat. Where does Ozempic fit into weight loss, since it's a drug for type 2 diabetes? Well, you see, weight loss and weight gain is a fine balance between the number of calories consumed and the number of calories burned via exercise or based on your metabolic rate. If you reduce the number of calories you consume because your appetite is less, then you have tipped the balance to one side and you burn more calories than you consume, ultimately resulting in weight loss. This is a pretty big deal in the context of potential anti-obesity medicines, as healthcare professionals report that the effects of the medication begin merely within 6 weeks, an effect you would not otherwise see if you simply just started increasing your physical activity, which, as I said in the beginning, would take much longer to achieve. It might not come as a surprise to you, therefore, that even though Ozempic has been licensed by NICE and the FDA as a drug for diabetic purposes only, it has been abused, unfortunately, by celebrities and athletes, such as, for example, bodybuilders, for rapid weight loss off-label. Indeed, high-profile individuals, such as, for example, Elon Musk, Oprah Winfrey, Amy Schumer, and more, have openly admitted to using Ozempic for weight loss. In fact, because of Ozempic's increased off-license use for weight loss, because it has been so severe, Ozempic was in shortage around England, resulting in Novo Nordisk developing the same compound, semaglutide, for weight loss under a different name, Wegovy. Wegovy was approved by NICE last September and is now in use for weight management in the NHS. It is therefore crucial that we should understand the potential benefits, but also the side effects associated with this treatment. So I mentioned that the active compound in these medications, semaglutide, increases satiety. But what else does it do? Well, it also increases insulin secretion from specialized cells in the pancreas. Insulin can then access the brain from the blood to enhance suppression of appetite in the hypothalamus. It also acts directly on the stomach to relax the smooth muscle in the lining of the stomach to delay the rate at which it empties. This means that since your digestion of food is slower, there are fewer signals being relayed back to the hypothalamus that you are hungry, and therefore you consume less food. This also means that the rate at which the food passes through to the intestines for regestion as feces is slower. This is where the potential side effects come in. In fact, the most common side effects with these medications are indigestion and gastrointestinal disturbances, such as diarrhea. Nonetheless, these side effects are quite mild, giving semaglutide a great safety and toxicity profile. Since semaglutide mimics a hormone that is naturally produced by the body, the way the drug is metabolized is not mediated by the liver, but through cleavage of the peptide through enzymes in the body, therefore eliminating any potential liver toxicity through its administration. If you remember, semaglutide mainly acts by acting on the hypothalamus to regulate food intake. The hypothalamus, however, is also responsible for the regulation of mood. Some recent evidence suggests the possibility of semaglutide inducing depressive-like symptoms, but it is too soon to determine whether there is a correlation between the two, as most of the evidence is currently inconclusive. That being said though, semaglutide can revolutionize the lives of those struggling with obesity. There have been multiple trials demonstrating its efficacy in obesity, justifying its widespread use for that indication today. In fact, it has been so effective that the same manufacturers have rolled out an ingestible tablet of semaglutide under the trade name Rybelsus for better patient compliance and ease of administration compared to injections. In terms of dosage, Rybelsus starts with a 3 mg once daily for 30 days dose, and after 30 days on the 3 mg dose can be increased to 7 mg once daily if no effect is observed. However, Rybelsus is yet to be rolled out in the NHS for weight loss indications, just for type 2 diabetes thus far, but the future is hopeful. The oral formulation also possesses additional compounds to enhance the drug's absorption through the gut and prolong its effects that I have just spoken about. Semaglutide offers a great alternative, as individuals struggling with obesity have thus far only relied upon gastric bypass surgery, an invasive procedure where a portion of an individual's stomach is removed to reduce its capacity. Like any other intervention for combating obesity, however, semaglutide needs to be accompanied by lifestyle alterations to maximize its efficacy as an anti-obesity drug, as a striking 90% of individuals who lose weight rapidly are unable to keep the weight off long term. And semaglutide is no different, as the patients cannot be on the drug forever due to the gastrointestinal adverse effects that I mentioned earlier. Moreover, for as long as semaglutide is taken, the patient will keep losing weight, which can promote excessive weight loss. It is therefore essential to adopt a healthy, balanced diet, increasing daily activity levels to prevent a weight rebound. A healthy lifestyle will go a long way, not just on physical appearance, but to reduce all the comorbidities we mentioned without needing invasive procedures and to enhance the long-term effects of the drug. So to conclude, we have explored the use of Ozempic and why it is gaining increasing popularity for weight loss. We then went through the mechanism of action of Ozempic's active ingredient, semaglutide, as well as the risks and benefits of the drug for people struggling with obesity. I personally think that semaglutide is an amazing new treatment for patients struggling with obesity, who are on the morbidly obese range and are looking to improve the quality of life effectively and rapidly. Once that is done, lifestyle changes are essential for the maintenance of the great improvements that semaglutide provides for them, in order for them to live a better life and a longer one. Those looking to lose weight rapidly who are abusing the medication to see quick results, however, should attempt to make lifestyle changes first that will help them live better and longer. Like for example, going to the gym for a few hours a week or going for a walk. If people continue abusing semaglutide for weight loss, off-label, the drug shortages will worsen. And the Department for Health and Social Care, along with NHS England, warned that all medications should not be prescribed off license, emphasizing the benefits to the wider healthcare community if these lifestyle changes are made properly and the drug is used properly. So, is Ozempic truly a wonder weight loss drug? Well, Ozempic's active compound definitely is, but only time will tell of its longitudinal impact on adult obesity, and whether the striking 25% obese population in England changes over the time that it is administered to patients. That's all for today, friends. Thank you for joining, and don't forget to tune in for next week's episode.